Hello, good people. How are you today? I hope that you are doing well. I hope this day finds you happy and in perfect peace and in perfect health. Today is June 13th. So that means it's the 13th day of Uterine Cancer Awareness Month. And so, as I always say at the beginning, as a uterine health advocate, I feel it's my duty to align with initiatives and programs and awareness month to bring information about all things uterine health and of course uterine cancer for this month. And I'm committed to posting as much as possible. So far, it's been 13 days and I'm still going strong. But to be able to provide information for you or to you. And I'm also learning because as I'm doing research on things, I'm also learning, let's put this down a little bit. I'm also learning too about things. So I feel very grateful for this journey as well. So thanks again, as per usual, for always engaging in the channel, watching the videos, subscribing, liking, commenting, sharing, all of the things that brings engagement to this wonderful channel about uterine health. So per usual, I'd like to put my disclaimers in the description, but I do like to make sure everyone knows I am not a medical doctor. I am a uterine health advocate, and I am just here. I won't say just. I am here to present and provide high-level bullet point information, hopefully information that empowers you to have a better medical journey, healing journey, health journey. Provide you information that you might be able to share with someone else because you're going to say, ooh, she provided that information on her page, and then you're going to direct everybody to my page, and then they're going to subscribe and they're going to start interacting with the whole channel. Love it. Yes, that's me. So before I get into today's topic, I did want to say that I did go back and next to each day, I was just putting Uterine Cancer Awareness Month. I didn't put the title of what the topic of the day, just in case you ever want to come back and say, what day did she talk about this? What day did she talk about that? You'll see it next to that. I did do that. So I'm still learning how to do things on social media and mainly YouTube. And so, bear with me as I continue to learn and grow. Being in front of the camera is not my forte and not anything in a million gazillion years I ever wanted to do. So, but here I am talking to you about uterine health. Okay, so today, on this channel, I talk about a number of things. I started off strong talking about, the uterine cancer rates and different things of that nature. And then I'm talking about different things. And so I talk about a lot of maybe unusual topics because, they may come up in your brain like they come up in mine. So I just think that I would share. They're always going to be about uterine health. They just may be a little, I don't know, not what you would typically find during an awareness month. I don't know. Like yesterday, I told you about the different, or I shared with you, I shared with you about the different types of gynecologists that they are, Maybe you knew that, maybe you didn't, but it's still something about uterine health. So I wanted to take it a little further and even, I dug a little deeper. Today, I want to talk about what does it mean when a doctor says they are board certified, I heard that on Dr. Kimmy Dawes. I told you I follow her. I'm a big fan. You know that. Because, I got her book, her latest book out here. But when she said that, she introduced herself and she says, I'm a double board certified. And to me, I'm just like, I didn't know what that meant, but I was just like, oh, double board certified. Yes, girl. Yes. I was, clapping for her and everything. So I decided to do a deep dive and to see what that really means, because it does mean something. And so to see what it means. So if you get a doctor and they're board certified in something, know that it means something, right? Well, all of it means something. So did my internet research. And of course I got, an overview. So being board certified means a medical professional has voluntarily passed rigorous written, oral, and practical exams in their specific medical specialty, proving they possess advanced expertise. So it is not required that you, at least not that I to see in my research, that you become board certified. It says here that they voluntarily pass rigorous written, oral, and practical exams in their medical specialty, and proving that they have some kind of advanced knowledge in the practice. So when we talked about the various doctors that they are, gynecologists that they are, so this kind of pairs with that. So what is the difference between being board certified and a state licensure? So while a state licensure well, I won't say simply, this is what it says. While a state licensure allows a doctor to practice medicine, a board certification proves they have mastered the standards of their chosen field. So they're just going a little deeper, because remember yesterday when I was talking about the different types of gynecologists there are, some are just gynecologists and they're right there. They're not going into this area, they're not going into this area, they're staying there. So someone that's board certified, they may want to go into a specialty area, and that's good. So a state medical license legally is legally required to practice medicine. So any doctor that you go to should have a state license and license to practice medicine in that state. It established that a doctor meets the baseline safety and competency standards. And so I do know, I hear it sometimes on the news, and they were not licensed to practice in this state and this, and that. So we do have to, I do think we have to do our due diligence to make sure our doctors are who they say they are too, right? So that's important. And so I know sometimes doctors, the way things are nowadays, they can be licensed in a number of different states as well. You see some doctors getting on planes and trains and going different places as well. So that's a state license. When they are board certified, which is completely voluntary, you don't have to go to the next level. I mean, think about it. They did 4 years of undergrad. I think it's 4 years of medical. I think it might be 7 years of residency, I think. And then after that, so yeah. So board certification is completely voluntary, and it's an advanced credential that requires years of specialized training beyond the minimal requirement. So beyond the baseline requirements to become a medical doctor, these doctors that are board certified have made the choice, the decision to pursue their heart's desire and spend more time in school to become a specialist in an area. And we say thank you. I thought to myself, we always say thank you to people that have served in the military, and rightfully so. But thank you for your service to the doctors, all those years of medical school, and then maybe going to get board certified, or really staying abreast of the latest and greatest information to provide each and every one of us the great care that we're looking for. So thank you for your service and your time studying all those years, and to then go into something specialty that, really brings healing for women in search of their journey. And board certification is not just for the gynecological field, it's in all fields. But since we're talking about uterine health, that is why I'm thanking the doctors that way. So here are the requirements to become board certified. And it varies by specialty, but this is just a general overview. So they must have graduated from an accredited medical school, which is so important. And we know that if you go to college, how important it is to go to an accredited college. We see some things that are not accredited. You think they're accredited because of names and recognitions, and they're not. And it doesn't really help you. It's almost like you wasted your time. So in order to get board certified, they must have graduated from an accredited medical school, hold a valid state medical license, and complete 3 to 7 years of specialized residency or fellowship training. So in addition to their time in medical school, they will spend an additional, seems like 3 to, probably depending on the specialty, 3 to 7 years of residency and fellowship training. They must pass comprehensive board exams. I'm sure it's probably not one. I mean, my goodness. Remember the SAT, the ACT? Oh my goodness. And they must commit to ongoing education and periodic assessments to keep their certification active, which I think is pretty cool. And I think that's nice. So if someone says they're board certified and they're current with their board certification, that lets me know that they are committed to going to pursue ongoing education. And it's like so many different types of licenses that people have in a variety of fields where, in order to keep their license, current and up to date, they have to complete so many hours of this and so many hours of that. Because like I gave the analogy, our cell phones are constantly updating and changing. And, I did mention in one of the videos about a study from 2002 and how that's probably, that's being nulled out. So, as things are changing, it's important too that our doctors know what new studies and science and things that are happening in the community, with people. Because also, in addition to the sciences, there are things that might happen to people in a certain region that may not happen anywhere else. And the doctors in medicine may not know about it until they find out about it, and then they could provide more information. So I think that that's really nice. So why does board certification really matter? Board certification gives patients and hospitals a reliable seal of approval. It ensures that the specialist stays up to date with the latest medical advances, treatments, and safety protocols. Most major hospitals and health systems now require, their attending physicians to be board certified. So that is probably true. I'm going to check to see if my gynecologist is board certified. I never asked her, but I think about the number of times I've brought up some of the practices or maybe some procedures that I had read about in an older medical book. And she did say, well, that practice is no longer in use. It's outdated. We're now doing this because we find that this is more effective and things of that nature. So even if your doctor isn't board certified, it's nice to know that your doctor still stays up to breast on what's current and what's modern. So I'm sure that it's very good to say to a doctor that is board certified. And you can verify if your doctor holds a valid credential by checking their status on certificationmatters.org. So if you meet somebody, your doctor, and you're doing your research, your due diligence, you can go to certificationmatters.org, and I'll put this in the description as well, and it'll let you know. So I think that that is good. And just for reference purposes, when I look at Dr. Kimmy Dawes in her book, and she mentioned that she's double certified. If I'm reading it correctly, she's double certified because she's a gynecological oncologist, which means she deals with cancer, and she's a uterine cancer scientist. So those are her. If I'm reading this correctly, in addition to being a physician, a surgeon, advocate, author, all the things. She's double board certified. So that's what kind of like triggered me to figure out, well, what does this mean? I know it sounds good, but now that I know what it means, and as I follow her on social media, she does provide things up to date. And I'm sure she's speaking more to doctors than she's speaking to me, but just to know some of the things that she's saying as I'm doing my research and I'm becoming an advocate, it is very helpful to me as well. So, as per usual, I'm going to give you two articles for reference. One is from the American Board of Physician Specialists, and it's entitled, "What Does a Board Certification Mean?" You can go there if you want to get some deeper information. And the next one is from the American Board of Cosmetic Surgery. It's from February 2019, and it says, "So what does a physician board certification actually mean?" So they have some very more, in-depth information. And I'm sure, because these are professional American board organizations, I'm sure a lot of doctors go there too before they pursue getting to become board certified. So again, I hope information like this is very helpful to you because it is still talking about uterine health. It is still talking about uterine cancer because, like we just see with Dr. Dahl. So we want to make sure that we understand but who we're seeing when we go to the doctor. We can research. Now that we know that there's several different types of gynecology, we can also see, what the doctors possess and what specialty they really what specialty they possess, yes. And this can help you choose a doctor based on your symptoms, how you're feeling. You can have different conversation than maybe you couldn't, with someone else. So I think it's important that we get all of the information so that we can make good decisions as we are journeying towards being very whole, very healthy, and very well in every area of our lives. So I hope this information was important. Well, it's important. I hope it was helpful to you. And I hope that you have a great day. Sometimes I got to laugh at myself, guys, because I told you, me and this camera stuff, I'm like, oh my gosh. So I hope this was very helpful to you. And I hope that you have a great day. And I hope that you are well and you stay well and you remain well. Okay, until next time.